It's Windwellness Nerd Out time! What's going on, guys? Happy Windwellness Nerd Out time. And today, we're going to be finishing our discussion on testosterone. It's been testosterone this whole week. John Pagade, how you doing? Thank you for hopping on, my fine feathered friend. I hope you get something out of this. Before we get into it, though, I do want to say happy birthday, Anmoldeep Singh. Happy birthday, my brother. I hope you're having a great day today. I love you, dude. It's been a long time, but this one's for you. We're going to talk about him more at the end. As for now, let's get into our discussion on testosterone. And today, we are more specifically going to be focusing on the effects of testosterone in women, and we'll touch on polycystic ovarian syndrome a little bit. I'm sure most of you have heard of PCOS. So to kick it off, when we talk about testosterone in women, well, where is it produced, right? Because in males, the vast majority is produced in the testes as it's converted from cholesterol via Leydig cells, right? And we talked about how, you know, the whole process from the hypothalamus all the way to the testes in its production, right? But without touching on all those players, obviously we don't have the testes in women, and so women produce their testosterone in the ovaries and in the adrenal cortex, as men also produce small amounts of testosterone in the adrenal cortex, but again, the vast majority in the testes. All right, so we talk about this production of testosterone in the ovaries and the adrenal cortex, the zona reticularis layer of the adrenal cortex, to be more specific, right? But, what is it responsible for in females? Testosterone. Well, testosterone in women plays a major role in the growth or development, maintenance, and repair of reproductive tissues. Not to mention, testosterone plays a major role in bone health, right? We talked about bone density in men, with higher levels correlating to higher levels of bone density and lower levels to lower levels of bone density, right? Increasing your risk for fractures as we get older and our testosterone drops, right? For example, testosterone's also involved in muscle mass. It's involved in fat metabolism and erythropoiesis, or the production of red blood cells. And as males have significantly more testosterone than females, if you weren't with us in our discussions recently in the past few days on testosterone and its effects in men, as men again have higher levels of testosterone than women, it promotes more erythropoiesis, right? And so what does that mean? We're going to get more red blood cells, and that's one of the major reasons that men have a higher red blood cell count than do females, all right? And it's another reason that when we get low amounts of testosterone, it can lead to things like anemia, among many other things. And we'll talk about low T here in a minute with women. JMO, what's up, buddy? How you doing? JMO making his appearance here. Daily appearance of When Wellness. All right, that's enough, bud. Go have fun. So, those are some things that testosterone is involved with in women. And when we talk about excessively high levels of testosterone in women, what can that cause or lead to, right? It could cause fertility issues. It could cause irregular or even absent menstrual periods. Could overly high levels of testosterone in women. It could cause the development of acne, the deepening of the voice, increased muscle mass, increased facial hair, or hirsutism, we could say, is the medical terminology for that. And increased hair in the body in general, right? Places that females do not normally have prominent hair growth. And in addition to that, frontal balding or thinning of the hair on the head. Those are a few things that we can get from overly high testosterone. So, when we talk about testosterone, well, very high levels. I wanted to mention PCOS today because, high levels of androgens in general, these male hormones circulating in the blood, is associated with polycystic ovarian syndrome in women. And when we talk about polycystic ovarian syndrome, we just mean, poly is many, right? Cystic, cysts, ovarian in the ovaries, and syndrome, right? So we have numerous small cysts in the ovaries, as the name precedes itself. And this is usually seen as PCOS in women of childbearing years that are having difficulty trying to get pregnant, right? And some things that we get with PCOS, well, again, there are higher amounts than normal of circulating male hormones, right, in the blood, and androgens, increased androgen production, right? Andro means male, and gen means to produce, right? So, it makes sense in the name. And androgen is something where, is responsible for producing male sexual characteristics, as testosterone is considered such, right? And when we have this increase in androgens, well, then it's no surprise we get similar symptoms to an increase in testosterone. So yeah, we're going to get those irregular or absent menstrual periods, potential fertility issues, right? We're going to get increased fat mass, right? So obesity is a risk. And this causes women with PCOS to sometimes have that apple-shaped body, all right? We get the facial hair, or hirsutism, right? We get excessive hair on the body and things like that, right? So having said that, what is going to happen if we have, I'll get to you guys in a second. I think I see Evo on there. What's up, baby? How you doing, brother? Thanks for hopping on. But we're gonna let's talk about what happens with low amounts of testosterone here in a second. But I do want you to understand we're not going to talk about everything with PCOS today in itself. I kind of just wanted to talk about how it's related to testosterone, because that's what we're going over today. 1 second. But when we talk about other complications we could get with polycystic ovarian syndrome, well, you could get insulin resistance. You could get, issues with carbohydrate metabolism. You can get higher amounts of triglycerides in the blood, hypertension or high blood pressure, right? We could get higher levels of LDL cholesterol, lower levels of HDL cholesterol, right? We also get acne with PCOS, like we do with excessively high levels of testosterone in women. So those are a few potential complications. And when we talk about low amounts of testosterone in women, now again, albeit women don't produce much, you still need some, all right? You still need some. So if we're not getting enough, we could have sleep disturbances, weight gain. We could have, and weight gain again is a complication of polycystic ovarian syndrome, as we have impaired glucose metabolism and insulin resistance, right? And high amounts of triglycerides in the blood, and our cholesterol is all out of whack, right? But on top of sleep disturbance, we get decreased libido and sexual satisfaction in general, all right? So aside from that, you're looking at lethargy and fatigue, right? You just don't have as much energy. Whereas if we had way more testosterone in men and women, they would get that aggressiveness and a deeper voice, hey, how you doing? But puff the chest out, But on top of that, when we talk about low amounts of testosterone, you can also get, muscle hypertrophy, right? Because we said that if we had higher amounts of testosterone, it could increase muscle mass. And this is not to mention the fertility issues we still get and irregular or absent menstrual periods. So the irregular menstrual periods happens with too high or too low on the scale of testosterone, all right? So same with the fertility issues, right? So be in the optimal range, baby. That's where we're looking to be. And if you want to know some foods that have it and lifestyle changes you can make, check out our video yesterday. We talked all about it. So It was some good stuff. Now, before we go, let's say hi to the people, and let's talk about Emerald Deep for a second here. Who do we got? John, I said hi to you. Eva, I'll say hi to you again because I love you, baby. Health works for you. That's damn right. It does. Always will. Mark Seeger, how you doing, Mark? Thank you for hopping on, baby. Hope you got something out of this. So, when we talk about Emerald Deep, we're going to say happy birthday because it's your birthday and I love you and I miss you. And we also call him Deep, you know, for short. And I was Deep's roommate along with Sean, who I love you too. Sean, Arjot, or Sean, you know. You're the man too. I love both you guys, and I hope I get to see you soon. You know, I hope you're both doing great. And you know, when I think of Deep, because this is his day, we'll give Sean his day too. I think of a very down-to-earth, good, genuine person that loved to stay up late at night and play World of Warcraft while I was trying to sleep, but I didn't care because I love him as a person, and I couldn't sleep anyway because I took too much pre-workout too late in the night. So really, it didn't even matter. But yeah, man, I remember you loved that, and it was something you might not know about Deep is he's good at basketball. He loves basketball. So, you know, maybe we could shoot some hoops one time, man. That would be really cool. And I want you to know 100,000%. This one is for you, my friend, and it's forever your day in the book of Wend Wellness. So thank you so much for being a great person. Keep being you. Don't ever change unless it's for the better, and have a better year this coming year than you did last year. All right, happy birthday, baby. Thank you guys very much. Great quick discussion. Not that quick, but great one nonetheless. We're all done with testosterone. We'll move on to something else tomorrow. Not sure what, not sure when, but we'll see you then. Have a great rest of your night, folks. Happy Wend Wellness.